Family members of Vanessa Maynard, a nurse who recently died at the infectious disease hospital, held a vigil outside of the hospital seeking answers and are calling for a thorough investigation into her death. Anissa Maynard, her niece, said the family needs answers and better systems must be put in place to prevent a reoccurrence.
We need answers. We need a lot of answers because we don't need no other family to be going through this. Put things in place, put system in place that you have these facilities that when patients come here, they can be taken care of properly and the way they should. A hospital like this, you ain't supposed to be leaving there to go nowhere for no other treatment or leaving there to go nowhere for anything else. Everything should be here because this is where you're bringing your family, and so they're supposed to have good treatment with this particular virus that's going around. We know it's going to be here for a while, so then put things in place. You can't have somebody's loved one in here. If it was their loved ones, would they be treated like that? No. Why other people must be going through these things? This is not nice. This is not nice. When people react a certain way, they like to say, oh, we're hooligans and we're this, but people don't know how we're feeling. People don't know what we're going through.
She said her aunt was the glue to the family.
Who we gonna go to now? Who we gonna call? Who gonna do the planning of family function and events? Because that was her specialty. That is what she liked doing. That's what she does. She always bringing the family and keeping us together. So she not being here is a big loss for us. Very big.
The family is upset with the lack of medical care she received while at the facility. They are alleging that she was left for hours without any medication. The woman via voice note related to family members what was taking place.
I'm like, people say when you're coming here, you gotta start planning. Your family gotta start planning for funeral because you know what goes on in here. I said, but the treatment that my aunt received in here, it was not nice at all. It was heartbreaking, especially to know that the field of work she's in, she's a nurse. It's not that I'm saying she should get special treatment, you know, but most of them knew that she was a nurse. How can you treat somebody like that, have them in the sun all day, promising to do this, not corresponding with each other so people know exactly what. If they communicate more, we won't have all them numbers they're giving us every single day. They're proud to talk about how many people are dying, but how they don't proud to talk about developing the treatment, the facilities. If they had these things here, we won't be standing here right now. We would not be here. Treat them properly. It's like when you bring them here, it's to kill them.
Dr. Karen Cummins, former junior health minister in the APNU AFC government, said she was perturbed by the development.
I want to tell the nurse that we feel their pain, and we're calling on the authorities to do some introspection, to look at their plan. There is no plan right now. Take shame out of their eyes, as we would say. Shame out of their faces, and sit down at the table and go back to the drawing room and develop a comprehensive plan. If you need the opposition to be with you, well, so far we are free to work with you as a team so that we can contain this virus and we can bring the death toll down. But definitely there's structural readjustments as it comes to health care in Guyana. So we're calling on the Minister of Health and his team to look into this matter that it doesn't occur again.
Also on the vigil was Member of Parliament Ganesh Naipal, and he said the death of Nurse Maynard requires people to speak out and demand of the administration how they operate at the COVID-19 hospital.
The people who are working here, I do not know what are their conditions. I do not know what is it that they face on a daily basis who work here. I do not know if they're traumatized. I do not know if they're psychologically disturbed. I do not know how is it that they go home and deal with their families and so on. This approach that is necessary, to which I speak of, requires not just the Ministry of Health, it requires the Ministry of Human Services and Social Security, it requires the Ministry of Labor, it requires all hands on deck so that you can assess your workers, you can assess the situation, and you can put measures in place where the people who work here will be trained to deliver a quality of service that will bring comfort to family members, even if their loved one is to pass away. You don't want them to pass away, but people have to die. We can't run from that. Death is inevitable. I will die someday, you will die someday. But you must not die under circumstances where you have to question the quality of service you receive from an institution that has to be administered by the state.
Families asking for the authorities to improve on the standards.